The two big concerns that we get are, of course, pain and side effects. In today's video, I'm going to be reviewing this with one of our patients, and we're going to show you all the ways that we can make treatments more comfortable. We're also going to go through all the possible side effects and what we do to alleviate those side effects. Hi, I'm Becky. I've been a registered nurse for over 30 years now, and I've been building my business here at External Affairs Medical Spas for the last almost 25 years. My family started this business many years ago. Our specialty is beauty and regenerative medicine, which means that not only do we want to help people look and feel great on the outside, but we also want to start on the inside and really look at things like hormones and nutrition and all of those things that go together. The purpose of our videos is to educate people better when it comes to these procedures. So many clients have fears, and by producing better content, we're hoping that we can alleviate some of those fears. We really appreciate your feedback, and we want to know what you want to know. So please pop your questions in the comment section below, and we'll make future videos to address your questions. So Sherry, we've already gone through your consent form for the neurotoxin for the Dysport, but now I'm going to go through your consent form for the fillers. So today we're going to be using Restylane, which is a hyaluronic acid filler. It's actually been on the market for the longest in Canada. But I do want to go through kind of the more common complications and then the less common. So we always talk about swelling, redness, and bruising, okay? Anytime we're poking you, there's a risk of hitting a vein or, a vessel that could cause a bruise and have some swelling. So I often tell patients, don't do these treatments within maybe 2 weeks or so of an important event, just so that you don't have to worry about covering that up. So that can certainly happen, and I'm gonna do some techniques today that will actually decrease that risk. We're gonna talk about pain, okay, and I'll actually give you a few little things that you can do to make sure that you're comfortable. Sometimes when the product is settling into the tissue, it can be a little bit itchy, that kind of thing. There can be discoloration, possibly from a bruise. Sometimes you can feel the product, especially the first week or two. And as I'm doing it, I'll go through that with you. So for example, in the cheek area, sometimes you can actually feel the product in there. That is normal, alrighty? Sometimes it takes even up to a few weeks for the product to really integrate into your tissue. And then the product is going to be attracting water, because that's what hyaluronic acid molecules do. So after a few weeks, you won't be able to feel it because it's part of your tissue, and it looks even better. More rare side effects, that we have on our consent forms, we actually have blocked blood vessels, blindness, and infections, alrighty? So I'm going to address why those are there. There are certain areas of the face, particularly in the middle, where there is an artery that comes up over your jawline, and it splits and it branches into different areas of the face. When it comes up the side here, it actually can backflow to feed the retinal artery. So there's certain areas, like in the middle here, where when we're using filler, using a needle to put it in is not the safest way to do it. So there's certain areas that we will use cannulas in the clinic, and as I'm doing that, I'll kind of explain that to you a little bit more. So we're decreasing the risk of those problems. There are certain areas in the world where they're using a lot of filler in the middle, here, in particular the Asian countries, because they're trying to bring their noses up. So when I talked about filler in the nose, that's why it's such a high risk area, is because there's very important arteries that run up each side. So if we ever chose to put product there, we're not going to use a needle. Same with up through here. We talked about this being a high risk area, especially when you're using a needle to put it in. I have a theory that when we're using a needle to put filler into the face, we either want to be underneath all the blood vessels, or we want to be above them. We don't want to be in that middle zone, in the big juicy part of the muscle, because that's where those arteries are. So it's super important that we keep those planes in mind when we're using a needle. Now the reason why we use cannulas more and more and more is because they're not sharp on the end. They're actually blunt. So it looks like a long tube, and sometimes I'll tell patients, when you get an IV started, that flexible tube that's left in your arm, in your vein, that's called a cannula. The ones that we use for fillers, they're very fine, but they're just a smaller version of that. If we were to look here, if you were to pretend that my fingers were veins and arteries in your skin, every time I poke with a needle, I risk hitting them, okay? So if I hit a vein, I could cause a bruise, but if I actually hit an artery and put product in it, that could actually block the blood supply to your tissue, which we don't want that to happen. If I use cannula, the cannula, because it's blunt, it actually kind of pushes things out of the way. So that's what makes it much more safe, alrighty? It feels a little bit different. You know, needles poking into the skin are easy because they just slide right through. Cannulas, it's a little bit trickier, and that's why not all injectors use them. You know, they're a little trickier for the injector to learn, and then, you know, we just have to coach the patient through what that feels like when we're doing it, but it's definitely safer. So Sherry, our goal here at External Affairs is to make these treatments as comfortable as they can possibly be. So we're gonna do a few things. We're gonna go through 5 different ways that we can make things more comfortable. So first of all, I can give you little squishy lips, okay? So I'll give those to you. And sometimes they're good just to give them a little squeeze if something is stressing you out a little bit. The other thing that we have is we have these, they're called beauty bars. It vibrates. So sometimes when I'm injecting a certain area, if it's uncomfortable, I might have you grab a hold of this. And sometimes if you even rest it along a bone or even on your hand, it's just a distraction. Okay. Because the brain can only accept so much stimuli. So if I'm poking you and you're vibrating the corner of your jaw, your brain kind of gets confused and it doesn't feel the poke as much. The other thing that we can do is sometimes we'll apply ice to an area before we treat it. So for example, sometimes the corners of the eyes, we can put a little bit of ice there. That helps shrink the little veins down so that they hide from the needle, but it also makes it more comfortable. We're also going to use a little bit of topical freezing. So we use a benzocaine, lidocaine, tetracaine cream, and we're going to be putting that around your mouth. And then the final thing that I'm going to do is I'm going to actually go inside your mouth and do a dental block. So just like at the dentist, where you get the little pokes inside, and we're aiming for the nerve here that will freeze this whole area, and then we'll aim for the nerves down here, and that'll freeze this whole area. So that'll make it really comfortable, okay?
If you enjoyed this video or found it helpful, please hit the like button, share it with your friends, subscribe, and hit the notification bell. And don't forget to leave us comments or questions down below so we can get to know you better.